in-person connections with colleagues, but I have to say also that I'm really missing the side trips to health centers. So when many of us, or I'll just speak for myself, when I travel, it is my opportunity to do whatever was the primary purpose for that airplane ride, and make sure that to the extent I can get out to health centers and feel that connection and see how the real world is working. And so that is one of the things that is toward the top of my list for when we can get moving again. And so I hope to have the opportunity in the future to come to Arizona, not just to see you in person, but to see the work that you're doing on the ground. And speaking of on the ground, there were all of these, a reference just recently to covering a lot of ground in the conference. I hope you've had a really great experience. So I'm joining you from the DC metro area, where on the ground are millions and millions and millions of cicadas. So we are, if you are not familiar with brood X, we have this little sliver of life here that occurs every 17 years, where the cicadas come out in droves. They are literally covering the trunks of trees. The hostas that are on the ground are covered with them. They're on the sidewalks, they're on the roads. The raccoons are feasting. And so we typically do our, oh, it snowed or it's hot or it's whatever. Our ground now is covered with cicadas. And so there's another reason why it would have been nice to see you in person, but actually really excited to get into some of the content with you all today. So I will begin. Let's see, there we go. Here we go. All right, so I will move through these slides with some vigor so that we make sure that we have time for some questions. And I do just really want to thank you as we get started for all of your work over the past many months. I just really have such an appreciation for all that you've done, and for me, and you know, the retirement words really resonate with me. I really do feel like it's been an honor and a privilege to work in support of what you all have done under the circumstances of this past many months to support patients across your state, and all of the partnerships that you've needed to engage in different ways to address the priorities in front of you, which were so fast changing and evolving and continue to evolve. And just really want you to know that we all, and not just myself, everyone in the Bureau of Primary Healthcare is thankful for all that you're doing, and really are doing all we can to support you. So I wanted to share this slide. This is hot off the presses. Jim shared began sharing these just this week. And this is the direction that we are looking to into the future. And so while we've had our foot in the world of the here and now and the urgent and the important, we've also had our foot in the future and thinking about where we want the program to go, and making sure that we are focused on the future, even as we're addressing the present. And so I wanted to just take a few minutes to walk through these priorities with you. I think they also provide a helpful framework as I talk about where we are now in terms of funding and policy, and certainly welcome your questions as they relate to these priorities or anything else that I cover that I think align with what you see on this slide. And so, you know, first I wanted to say what this means for us, right? And so I think we're in this space of the pandemic hopefully waning and being in a space where recovery and stabilization occurs, and there's a potential for additional resources for the health center program. And so these would be the priorities and the lenses through which we would look with additional resources as we go into the future, as well as the ways that we might think about how our policies are supporting, how we can otherwise incentivize, how we can build into ongoing funding advancement of these goals and visions. And so first, you'll see a continued focus on increasing access. That is our bread and butter, isn't it, of the program, with a vision that every high-need community has access to the health center model of care. So we're doing a lot of thinking about what that actually looks like, and there's some practical pieces of that that I'll talk about later in terms of the service area needs assessment methodology and unmet need score as one way for us to have developed a way to differently understand need in communities. There are lots of other dimensions of that as well. But you'll see an equity lens throughout all of these priorities. And so really thinking about even how we award funding into the future and ask different kinds of questions about need and communities where there isn't a health center and why not, and what are the things that potentially we have done that have disincentivized those communities or have positioned them to not be successful in applying for new access points. And so really thinking about the future in terms of new access points, perhaps differently than we have in the past. A continued focus also on access to the range of services, with a vision that all health center patients have access to services that address both clinical and social barriers to health. So we've been talking about increasing access to comprehensive services, and it is meaningful that, that we are extending that definition to include a focus on health. So access is important. It's a means to an end. And we think that focus on health and not just disease and is important and something that we want to emphasize differently than we have in the past. Redefining comprehensive to incorporate a focus on social care. So not just clinical services, but those social barriers to health, and thinking about the opportunity potentially for us to do more investments if we had additional resources to differently position you to be successful by having additional enabling services so that you could you were differently enabled to understand what those social determinants were through your UDS data and more meaningfully connect patients to those resources in your community and build and close those referral loops to support those social determinants. The next goal is really around activating and accelerating innovation with a vision that health centers lead the nation in the delivery of high quality care that advances health equity. And I think you've heard Jim talk about this frequently, and his desire to put health centers on the cutting edge and really be leaders. And I think part of the way we're thinking about this will be embodied in our quality improvement fund that we're creating. And I'll talk a little bit about the Optimizing Virtual Care Notice of Funding opportunity that was released earlier this week as our first kind of toe in the water in that respect. But this is really thinking about a distinct line of funding that previously was used for quality improvement awards to help us more systematically and strategically accelerate advancements in clinical quality, in health outcomes, in reducing disparities, and to do that in a way that allows health centers to help us figure out how to solve problems and experiment. And instead of this singular focus on increased access, more doors for people to walk into, more services once you walk in the door, what are we doing with the doors and the services, and what are the ways that those services can be delivered, and what combination of providers and partnerships and supports to differently get at health outcomes and reduce those disparities and improve health equity. So we're really excited about that future without having a fully baked plan for all that would look like. And so these priorities we're sharing these with you because this is what we're thinking. But there's lots to figure out in all of these spaces. And so really I'm hoping for your feedback in terms of the different spaces that we could or should focus our resources into the future in that area. And then last but not least are our capital needs, and really our vision that health centers operate state-of-the-art facilities that optimize service delivery. And in our envisioning of this, we've imagined a world where we could have a fund that we could use for capital that was kind of a revolving fund. That requires lots of doing, not just resources, but some statutory changes, but really excited about the possibilities and thinking about the ways that we could differently leverage not just our loan guarantee program and capital funding as appropriated, but to really sort of bake in a capacity that recognizes the ongoing needs for health centers to improve their facilities, and also the need to expand facilities to increase access to services. So that's a little bit about where we're headed. Now we'll do just a quick look back, and this is always a good touch point for me and a reminder of the contributions that you all make. And we'll have updated data soon. But this past year really gave different meaning to this contribution, and the fact that you have these established relationships and trusted, the trust of these populations that you've been able to leverage in a way that got this country to a place that it wouldn't have gotten to without you. And so again, a thank you to all that you've done to support these and other populations in your communities. So it wouldn't be a funding update without a touch on the American Rescue Plan. And I suspect I'm telling you nothing that you don't already know. So I'll move through this pretty quickly and just, excuse me, highlight some key reminders and also note when you add up the fiscal year 21 appropriations plus the dollars that we're awarding or have awarded through the American Rescue Plan, we're at $13.239 billion. That's a significant investment and a significant recognition of what the health center program does, what you do, and your critical role in not just responding to the pandemic, but the recognition of the critical importance of that maintaining and increasing capacity and the need for you to be there as we move into a recovery and stabilization phase. So in terms of Arizona health centers, I think we're at 135 million for you all in the health center sort of lane of that funding around COVID vaccination capacity, response and treatment, and maintaining and increasing capacity and recovery and A&R. So I hope that you all are nearing the end or have completed your plans and budgets and submitted them to us, and certainly happy to answer any questions that you have in that respect. Likewise, appreciation for all that lookalikes are doing and additional dollars for them with the same formula-based funding, but through an application process. And we've just gotten all of those applications in from lookalikes. So we turn things around quickly and they turn things around quickly. There's a lot of doing things quickly these days. And then the American Rescue Plan funding for capital, hopefully you all are thinking through, at least funded health centers are thinking through what those capital needs are as they relate to constructing new facilities, renovating or expanding existing facilities, and purchasing equipment. There's a little more time for those applications being due at the end of June 24th. And then we were really pleased to be able to award additional resources to our training and technical assistance partners, $32 million. We couldn't do what we do without them. And so really appreciate all that they do and support you with, and hope that you are working together with them to make sure that they are aware, they being PCA, HCNs that you're participating with, and national training and technical assistance partners with whom you engage, to be clear about what your needs are, and then really take advantage of the resources that they provide to you. And last but certainly not least, we have Native Hawaiian health systems that we support through HRSA, and we are going to be awarding those, or at least issuing a notice of funding opportunity for those organizations soon and shortly. So we also had some other activities occurring in fiscal year 21, supporting critical areas of work and keeping the foot on the gas in areas that are of importance. Of note is our National Hypertension Control Initiative, and this was supplemental funding that we awarded earlier this year to about 500 health centers, $90 million. To support the use of self-measured blood pressure technology to increase the number of patients with controlled hypertension. And this was notable in a couple of ways. It is somewhat of a trying of a new thing. And it is one of the first funding opportunities that really focused on the movement of a needle around a clinical quality indicator and an actual health outcome measure. It was also unique insofar as it focused resources on lower performing health centers, and with a hypothesis that part of the reason for that was that additional resources could move them along a continuum in a way that perhaps wasn't as needed for others, and that additional technical assistance could support in this space as well. So we were excited to be able to put those resources out, and of course those were awarded in collaboration with the Office of Minority Health. We were also excited to be able to provide resources. I point with my mouse and I have to just take my hand off there. Our primary care HIV prevention funding for fiscal year 21. We anticipate making these awards this summer. This is the second cohort of health centers that are located in the geographic areas targeted by the Ending the HIV Epidemic in the U.S. Initiative. And we started with a group of health centers that were co-funded with Ryan White. Then we moved out to the health centers in those areas that didn't have those relationships with Ryan White and were perhaps less experienced with HIV. And then what we hope in the future to then extend beyond even the targeted jurisdictions to be able to provide resources to health centers across the country in this area. And then our school-based service sites funding opportunity. These are also anticipated awards for later this summer to increase the number of patients who access services through school-based sites or service delivery sites located at schools. And this is $5 million for 25 awards. This is going to be incredibly competitive. There was a lot of interest in this funding and really shows us that there is a significant interest and need to bring services into schools. And there was never a time more, that's more true even for today, and looking at the need for vaccination of adolescents, and then at whatever point in the future that gets extended to younger children. And then, as I noted, and this is a fiscal year 2022 award, but the NOFO was released earlier this week. This is our, as I mentioned before, our toe in the water for our Quality Improvement Fund. This is a competitive funding opportunity to support health centers to innovate and test approaches. And as you may have heard me or others talk about before, we looked at health centers in COVID and that rapid transition to telehealth that was phenomenal and so incredibly needed and helpful, but not particularly strategic. It was, we've got to move from this to this, or we won't be able to serve people and be safe. And so this is with an eye to a future where, as I think many of us are thinking about workplaces changing, care delivery changing, that there's been a swing back, right, in the number in the visits that are being conducted by telehealth, but not a swing back that has gone back to baseline, where we were doing fewer than 1% of visits through telehealth before. I don't think anyone thinks that we're going to go back there, having learned about how this can work for providers and for patients, and particularly assuming that reimbursement for those visits continues. And so this funding is really, I think, pointing us into the future to help us collectively as a learning health center system to leverage virtual care to maximize access and improve health outcomes, and really have health centers help us ask key questions, make hypotheses about which technologies for which patients, for which services are going to get you the biggest bang for the buck in terms of clinical quality and improvements in health outcomes, and make hypotheses about that, test those hypotheses, collect evidence, share with one another in a learning community, and with the idea that at the end of this period of performance, that we will have, and an evaluator will help us to collect this real-time learning across the health centers that were funded, so that we can document, we can have that documented and disseminate those strategies that work. And frankly, perhaps as valuable is sharing the lessons learned about what didn't work. And so it's very new for us to be funding in this space. We're funding both success, and we're also knowing that we want to learn from what didn't work as well. And so really excited to see how we can learn from this, and also interested in hearing your thoughts and questions about it when we get to the time for the Q&A. And for those of you who for whom I haven't made this connection or haven't heard this connection as clearly made before, is that this Quality Improvement Fund, and this as the toe in the water, the first funding opportunity that we're doing in this space of a Quality Improvement Fund, is in many senses a replacement for our Quality Improvement Awards. So we are no longer planning to do Quality Improvement Awards, but we continuing, we plan to continue to recognize quality improvement, but not through funding, and instead using those dollars to proactively accelerate and advance quality improvement. There may be other ways that we do this in the future. I don't know that every funding opportunity is going to look like this one, and we're thinking about lots of different ideas with this combination of focus of innovation, and problem solving, and a focus on outcomes and equity. So I'm very interested in hearing your thoughts about directions that we might want to consider into the future. And so I'm going to move on to SAC. So will I complete a SAC or BPR for fiscal year 2022? So this is a little more brass tacks. We've begun releasing our service area competition for fiscal year 2022, and you will see in it if you are interested, and it might be interested even if you don't have a service area competition this year, to see what we're changing in that service area competition. And you will see in it that the patient-centered medical home recognition will provide priority points. So there is an advantage to health centers, established health centers, who have patient-centered medical home recognition, easy for me to say, in terms of their overall score in a SAC. And so that's just one example of I think how we're thinking about raising the bar, and EHRs are another example where we incrementally moved over time to supporting and then recognizing retrospectively through QIAs the use of EHRs to report data, and then moving to a place where, well, actually you're not eligible for award unless you report using your EHR. And so similarly, I think that's the space that we're moving into in terms of PCMH, still with a continued commitment to support folks in the path of getting that recognition with the contracts and other resources available, but in terms of quality improvement awards that actually provide resources retrospectively for the number of sites that are recognized. That is not part of our plan going forward. But it has been incorporated into SAC. And if you have a question about whether your health center has a SAC this year or not, and this doesn't answer the question for you, I encourage you to either reach out to your project officer or to contact health center program support, and we'd be happy to help you get clarity on what's next when for you. So moving into some COVID content, or back to COVID content, this is just a quick summary of COVID-19 funding specific to Arizona. And it's just a different view of the dollars that have been awarded. In terms of the American Rescue Plan, I think I mentioned $135 million for Arizona health centers, and really want to point you all to the focus that we're hoping that you all are taking within the buckets of activities that we've laid out and that I referenced earlier. The vaccination, the testing, treatment, the maintaining and increasing capacity, and the recovery and stabilization is also to really keep that lens on an equitable access to vaccine testing and treatment, and that equity lens there, as well as it relates to other needs of the area and social determinants of health. And so you'll see in the example activities are pointing to possible spaces where it may be helpful to use those resources to address some of those those areas of service that connect more to the space of social care and social determinants. Certainly not a requirement, but just wanted to draw your attention to that. And I can say from where I sit, and the Biden administration and our regular engagement with them around COVID and everything else, this is the lens. There is literally nothing I think that we turn around, and we turn around a lot. There's just a lot of back and forth of how you're doing this, or what are you planning for that? And in all of that I have visibility into, and it's a lot, this is the lens. And we are being asked to talk about equity in areas that it has never come up before. And there is absolutely a legitimate answer to the health center program by its very nature is by its foundation and purpose, and by its nature is disproportionately focusing resources on populations and areas where needs are greater, and so and as such is positioned and is addressing health equity. And I think there's also space and desire for us to be thinking about specifically how to do more and better in the space of population health and social determinants. So I said all of that in the context of funding, but that wasn't really all in the context of funding. It just, I think it's really relates to everything. Here's a quick look at COVID-19 operations in Arizona, and the data is a little outdated because that's how our world works in the clearance of slides. I did ask folks to pull some updated data for me so that I could see what it looked like as of 5/7, which I think was our most recent data. Not a lot of change, but also not surprising to you that there are small decreases in the weekly numbers around all of these areas, right? So, but nothing dramatic, but also nothing surprising insofar as, in particular, the vaccinations per week are dropped by a couple of thousand since this survey data. And curious if you have things to share in that space that would be helpful for me to know. Not because I have a question about it, because I understand that's occurring across the board. And we've shifted from what was the key priority was, supply, and now the key issue is hesitancy. So anyway, that's where you all stand in terms of the national and Arizona. Thought that look might be helpful. And then in a few slides on the COVID-19 vaccine program update. And so this is really specific to the health center program. And know that some of you are participating in the program and perhaps some of you are not. I think we have 8 grantees and 47 sites in Arizona who are participating in our program, knowing that you also have a vaccine supply from the state. But just a quick look at what you all and health centers overall have delivered on in such a short period of time in terms of actual vaccines administered through the program, with over 2.6 million doses in this very short amount of time through, again, through April 23rd. So it's actually more than this. Layering on vaccine allocations that are being made by jurisdictions. I think many of you may have seen that we hit the 10 million mark, and we're able to share that good news this week. So it's just a huge congratulations. I know that so much work has gone into this for all of you. Another look at this in terms of our special populations. And again, as I mentioned earlier, it's just the relationships that you all have with these populations have made all the difference in terms of these folks getting access to services overall, and then in this pandemic, in terms of the vaccination, and certainly I think similarly we would see this for testing and other services as well. So just wanted to give that quick view. And then, boy, has a lot been going on in terms of vaccination events. And so these were events that were supported again through the vaccine program. And then I think this is the last slide as it focuses on the vaccine program, just the steady increase of over time with a little bit of a different view. And then you can see Arizona at 15,780 doses as of 5/3. So congratulations for that. And some resources for you before we move on. So also just a plug too for you to tell us about what you're doing. These stories have been incredibly helpful for us. Can't tell you how helpful it is for us to get literally the picture and figuratively the picture on the ground. So if you haven't already, please consider sending your materials and stories to the mailbox, health center stories at HRSA.gov. And if you have photos, that's fantastic. That's helpful as well. So moving on to just a quick touch on related changes to UDS. And 2021 UDS reporting, we've updated UDS with the latest testing and vaccine codes. We've removed cervical cancer screening measure and other revisions in alignment with the CQMs. We've removed specific language for the Drug Addiction Treatment Act of 2000. We revised Table 9E to include American Rescue Plan funding. And all of these details are in the 2021 UDS manual that's available on the UDS resources webpage. I think we broke a record this year in terms of our ability to get that resource out to you earlier than we have before. So hopefully that is helpful to you. So now I'm going to move on. This is the point where I wish I could see faces and I'm staring at a screen. So I hope you all are with me. I'm going to crank through a couple more slides and then hopefully we'll have a chance to dialogue a little bit. So our policy updates, we're super excited to have the compliance manual on Espanol. That Spanish translation is available on the website. We remain committed to ensuring that we have resources to the extent we can, understandable, that we're providing clear and information to all of our health centers. And this translation is sort of our first step into the place of a complex policy document and putting that into a language accessible format. And we know that there's more that we can do in this place or in this space. So absolutely welcome your feedback on this translation and the extent to which we've achieved our goal of increasing clarity with it, and more to come on additional documents that we can work to provide access to in different ways. And then just a couple of policy updates for you. I know that many of you are interested in and tracking on all things 340B. So there was news around that. Is it this week? I don't know if it's this week or last week, maybe it was this week, in terms of the issue with contract pharmacies that I'm sure that you've been tracking on. The space that's been particularly in our domain has been the implementation of the executive order on access to affordable life-saving medications. So we are continuing to work in that space. I think you may be aware that there has been posted on the regs.gov website that an intention to rescind the final rule. I don't believe the proposal, there's not an intention. there's a notice of proposed rulemaking to rescind the final rule and to get comments on that proposal. And that the intention to post the proposal is on regs.gov. The actual notice of proposed rulemaking is not yet available, so it's not something that you can read. That's what I was trying to articulate. When you are able to read it, we very much welcome comments on that. We anticipate there will be a 30-day comment period on that proposed rule. It is specific to the rule itself, not to the executive order that underlies the rule. And then also wanted to draw your attention to some site visit protocol updates. I'm not going to go into those in this conversation. They will apply to site visits beginning after May 27th. And I believe that all of the details and the protocol itself will be posted. I get lost. I looked at it. I don't know if it's up yet, but it will be up soon and shortly if it's not up yet. And I think hopefully you will find it to be a more user-friendly, not just in terms of some of the clarifications that we've made to the site visit protocol. We've also converted it into a more modern web format in HTML. So there's a PDF version that you can download and print out, right? Like we know that people like to be able to do that, but there's also a much easier way to sort of get to where you want to go quickly if you have a question about something in a link by link format, similar to how the compliance manual is available. And the major updates I think you can find on the website. I'm happy to speak to them if anybody has a question about those, but I won't spend time unless that comes up as a need. I also wanted to give a plug for the Advancing Health Equity and Health Center Excellence Framework. This is something that we've been working on for a couple of years. It started as thinking around how might we tie our ongoing funding or otherwise incentivize performance improvement and use. I think there was a conceptualization at one point of what it might look like for us to do sort of value-based grants and come up with some kind of composite measure to understand the value proposition of a health center. And like we could potentially, fund SAC at 2% at upside or 2% at downside based on this composite measure. We explored this. We got a lot of feedback from you. We were working with the MITRE Corporation to think through this way of incentivizing and motivating performance improvement. And we determined that our value proposition isn't well articulated in a composite measure of anything. And it was really challenging to feel like we could get to a place where we could, with confidence, account for the variability of health centers and not in some unintended way undermine what it is we're trying to do and disincentivize things that we really want to incentivize, which is seeing those most complex patients, for example. And so where we moved instead was to this health center excellence framework, where we teased out the different domains of performance that we saw as contributing to health center excellence. And ultimately, this is our value proposition. This is what we're proposing is the value proposition of health centers, and that in each of these domains, and you can see that they include our traditional space of access as well as quality, but also include patient experience and population health and social determinants of health, as well as some of the more operational components of health centers, governance and management and workforce and financial sustainability, which certainly through especially those early months of COVID really provided some really stark contrast between health centers who were in different places as they relate to not just financial sustainability, but understanding of how many dollars are going to which site and what the revenues are where and which sites to close and which to keep open. And that sophistication was really, those more sophisticated in that space were better able to ride that portion of this pandemic out than others. And so how do we use our dollars? How do we use our training and technical assistance? How do we use our collective network to support health centers and to support one another, and you helping to support your peers, and asking your peers for help in areas where you're struggling in each of these domains. And so we're excited to have this framework. We're thinking about it in some concrete ways and also in some more abstract ways, and really welcome additional thoughts. There's more about the framework on our website under the strategic initiatives portion of the website. So you can see the whole model, and you can see the levels of performance that cross-cut each of these domains. And you can also see that fortuitously, we did bring to this framework the lens of health equity. So we had done lots of pulling together of what are these domains and what are these areas of focus within each of the domains, and then overlaid that with a question across all of them. Bring a health equity lens to each of them, and if it isn't already captured in what has been pulled together, let's take another crack at it and surface what it would mean for us, or where we can make sure that there's explicit language around getting to those outcomes. And so I think it is a resource that I'm excited about us using and experimenting with going forward. I think one example that we've been thinking about in terms of a practical use of this in the future, well, you could see a funding opportunity, right, that says it's focused on this, and then this gives us words and language to say, well, and these things in the space of access, and these things in the space of population health and social determinants, or these things are what we want you to put in an application that was speaking to an area that related to quality patient care and safety. But also we're thinking about this in terms of not just new dollars, not just training and technical assistance, but also how do we use our ongoing investments to support improvements in these areas and incentivize improvements in these areas. So a baby step in terms of incentivizing patient-centered medical home, absent a recognition of that with explicit quality improvement award funding. We've incorporated that as a means by which a health center can get priority points in their SAC application. We're thinking about SAC in the future and are considering how we evolve SAC from its focus on compliance, where compliance becomes, again, that's our baseline. And in this framework, it's the baseline level of performance in each of these areas. And so, okay, let's just say it's a given you're compliant, and perhaps we have people talk about what are your goals, where are you now, and what do you want to achieve in 2 or 3 of these domains, and how are you going to work on that over the next 3 years. And it's also a way for us to potentially differently understand, if the purpose of SAC is both setting out what it is you'll be doing for the next 3 years, the purpose of SAC is also your justification for why your health center continues to be best positioned to serve the area you're currently funded to serve. And so this gives a framework perhaps for you to be able to talk about that in a different way than past SAC applications have allowed. So that's just one example of how we're thinking about it. No decisions in that space yet. And I share that thinking because we really are interested in hearing from you if you have feedback for us in that space. And so I'm not gonna, this is the proposed unmet needs score 2.0, our measures and weights, as we have evaluated the performance of SANAM in the fiscal year 2019 new access point competition. That was a commitment we made when we rolled this out, that we had some, we had an intention for and a hypothesis that this would reduce burden and help us to target our resources better in terms of their focusing on areas of higher need, and we committed to evaluating the extent to which that occurred, and that evaluation brought confidence to us. We also wanted to look at the measures that were included in the model and evolve them over time as new measures became available and or from input based on that evaluation. And so you can see here where there are some changes. Again, I'm not going to go into this in great detail here, but these details are available on our website. And I think we actually have a webinar coming up that's going to talk about not just SANAM, but also another use of the data that informs the unmet needs score. So if you take the health center penetration pieces out of this model and just look at what's happening in the community without respect to whether health centers there or not, we think that view could be really helpful for health centers and potentially for us to understand community needs, and particularly with this increased emphasis on health disparities and social determinants of health. So there will be some, I think, a webinar upcoming on that soon for you to sort of learn what some of that thinking is in more detail and to provide some feedback. So look for the digest for that. And then before I leave this slide, I imagine that some of you have in the back of your mind, and this is my last sort of content slide for the presentation. So if you're tired of hearing me talking, the news is good. I'm almost done. I think the thought bubble I think many of you may have is what's happening with NAP. Is there going to be a new access point competition, or what is happening for fiscal year 2022? And that more to come there soon. I believe the president's budget will come out soon and shortly, and will be our first indication of the direction for the future. We plan for lots of eventualities, and so this is something that we're focused on, and this being updating the SANAM and having it ready for a new access competition, and preparing for a new access competition in the event we have resources to do one, but no plans at this point and no resources at this point for a new access point today. But we will be ready if and when there are resources. So just a quick reminder for you of the many resources I'm sure you are familiar with, but for those of you who may be newer to the mix, our website, if you aren't subscribed to our weekly e-newsletter, and there may be people, because of our virtual our virtual world, that may not have participated in one of these conferences before because it was too challenging to get away. Oh my gosh, Jim McCrae is calling me. No, I'm ignoring him. I told him, okay, that's my life. So please sign up to our weekly e-newsletter. If this is something you aren't aware of, I think it's really helpful for folks in all levels of organizations to keep tabs on what we're doing and what training is available, what technical assistance is available, and different updates from us. And then you'll see the Health Center Program Support link there. It is a little bit like calling and not having a human on the other end of the phone, but I assure you there are humans on the other side of that contact form. And the fact that we get your questions in this way help us so much to be able to make sure we're giving folks consistent answers, that we're tracking our timeliness, and that we're getting your questions to the people who are best positioned to answer them. And then certainly there's always your project officer who can navigate you to where you need to be. And then our resources from our strategic partners, our HCCNs, our NTAPs, and our PCAs. The link for those are there. And I will share this last slide and my email address. I'll let it sit there for a couple of minutes. If you want to jot it down, I welcome your feedback, and I will stop sharing and see what questions there might be.
Thank you, Dr. Joseph, for that really informative presentation. I heard a lot about equity, addressing disparities, outcomes. I love the idea of not just focusing on opening doors, but focusing on what's happening behind those doors. Really good stuff, so thank you. We do have several questions already. So our first one is related to, I think it was the policy slide that you had toward the end. Can you elaborate on what are considered life-saving medications?
Sure. So hold on. I'm having a hard time getting my Zoom into a view where I can, because you guys are still seeing my slides, yes?
I just took control, so you're
oh, that's good. I need people to take control. I wish that could happen more often. So the life-saving medications are defined in an executive order, and this executive order was established by the Trump administration. And so we issued a regulation to implement it, and the life-saving medications defined in this executive order are insulin and injectable epinephrine, and the executive order and the implementing regulation speak to requirements of health centers to provide access to those drugs at the 340B purchase price. And that's a very short summary. And but awesome. Those are the two drugs, insulin and injectable epinephrine.
Great, thank you. The next question is, do you know if there's any work being done around ACEs, adverse childhood experiences?
Oh, that is such a great question. There's much work being done around ACEs, and I've had the pleasure of meeting with lots of groups who have been interested in talking with us about what more health centers can do in the space of early childhood health, which then very quickly expands into those two generations of health and into childhood overall. And President Biden's in his campaign materials expressed an interest in having a early childhood specialist in every health center. Don't quote me on that. I have too many things running through my head. But this idea to bake in someone who is positioned on the care team to bring that lens and bring that focus to that developmental screening, connecting kids and moms and other family members and support folks around that child to resources. And so we've been having lots of conversations about I'm getting emergency alerts on my computer, so it can't be the cicadas. So we've been doing, I think, some interesting, having some really helpful conversations, and of course ACEs are certainly a part of that. And not just how do we minimize those, and even, I recall visiting health centers, and many of you may be in these spaces where there have been partnerships. And as I'm recalling this, I was in maybe Vermont or New Hampshire in a rural area, and the health center partnering with EMS and how the first responders were working with the health center to think through ways that they could minimize exposure to trauma from kids when they were responding to incidents in homes, et cetera, and really sort of building in not just what the health center was doing, but what the community was doing collectively to both minimize the ACEs occurring in the first place, and then certainly that trauma-informed care on the back end, and how we can support kids in that space. So you got me going, because it's one of those, I'm really excited about what some of the possibilities could be for health centers to, with additional resources, do more in this space. And so excited that there's interest in that.
Thank you. The next question is about OSVs. Are there plans to return to in-person, face-to-face OSVs, or will it be more of a hybrid model going forward?
So that's an interesting question, and I think we'll have some more updates in that space from Angela Powell, and we're gonna, I think, have it today with McRae coming up, and welcome everyone to be engaged in that. And we're on a path in the Bureau to sort of implement this this vision of how we work differently internally and with you. And a part of that is really rethinking our offices and what we're all doing, but a significant aspect of that is a more specific focus of one office on oversight of supplemental funding, and another office focused on oversight of compliance. And so that's why I said Angela Powell, because she is going to lead the office that's focusing on health center program monitoring, and Erna Hughes will be overseeing the office that's focused on the Office of Health Center Investment Oversight. And they're both doing some really fantastic thinking about how they're going to use their people and develop processes and systems to do our work more effectively, efficiency with less burden for you all, more support for you. And so in that space, I think you'll hear Angela talk about the different ways that she's thinking about focusing her people and how they're thinking about streamlining compliance, which is something we've been talking about for a while, and the real practical translation of what that might look like, and even thinking about potentially doing that in different risk-based ways. So I think more to come on what exactly that looks like. We don't have a point in time right now for when site visits would return to being in person. And we still, as federal employees, don't have flexibility for travel yet. But you know, that we see where the world's going. So I imagine soon, shortly, for a return to those in-person visits, but I do think our future is going to look different, and it's all over, right? Like that we end up in some version of hybrid would be my best guess, but I don't know exactly what that will look like.
Great, thank you. The next question is, where can we find more information about the QI funding changes?
Yeah, so that's a great question. I don't know the answer. Like, I don't know that we've done a great job of articulating that in words that you could find on our website. The Quality Improvement Fund is something that in truth is very much, it's a concept with the optimizing virtual care as an embodiment of that concept. And our first, you know, I can need a different analogy, but our first try at that. And so I don't think we have more to share other than what I've shared, which is this intention to support those innovative approaches that accelerate clinical quality improvement, health outcomes, reducing disparities, advancing equity. And what exactly that looks like, we don't know yet. So we have an FY22, and our next is FY23, which we're thinking about, like what does that look like?
Okay, and we'll keep an eye out here at the PCA for
Yeah.
more information and share it with everyone as it comes through. The next question is, can we anticipate that there will be pre-NAP release training provided by HRSA, such as in the past, like building great health centers?
So I think that those, I know that that was a resource that I know that NAC has done those. What are they? Starting with Success, I think they have done trainings in the past. We do not have plans we don't have plans for that. And so I think looking to our partners to support health centers who might want assistance in that space. If you are a health center that applied in the past and were not funded and have feedback from the objective reviewers and have questions about that, absolutely, that's something that we'd welcome you to reach out with us on. And I think even using health center program support as a way to navigate to someone in that space. And if it's not obvious how to do that there, I'd welcome an email, and it takes me a minute to forward it to the right person. So.
Thank you. One thing that we talked about earlier in the week that I would be curious to hear your thoughts on is around education, kind of preparing the workforce for what healthcare looks like now, especially related to telehealth. Someone had heard a trend that newer nurse practitioners were being discouraged from doing telehealth because they felt like they needed hands-on experience. So just curious if you're hearing anything at the HRSA level about educating our workforce differently with all of the changes that we've seen.
Well, I know the Bureau of Health Workforce is very much thinking about all things in that training space and how to prepare the workforce for the future. I personally don't have a specific lens into that particular question or that particular issue. And so happy if somebody wants to share that question, or maybe Danelle, if you can collect some of these, I'm happy to get those to the right people and follow up after this.
Okay, sounds good. Thank you. The next question is, are there any conversations at the federal level about working with other agencies to address social determinants of health, such as HUD or other agencies?
Absolutely. I think there have been, it's interesting in the space of COVID, and I think there are folks who are interested to learn from us as well as to work with us to reach different populations and address those social determinants. And I think those partnerships at the federal level have, where there were partnerships already, they've been strengthened. I think there's some new partnerships as well, just like at the state level and at the local level, you've made those connections that, oh my gosh, let's use them beyond the pandemic for our collective benefit. So absolutely. I think HUD in particular is very interested in working with us. And I know through some of the conversations I've had across government, really interested to learn from us in terms of the visibility and the understanding we have about what we're doing and our understanding of it by race and ethnicity and the value add that brings, and lessons learned that we can share with them.
Great, thank you. We look forward to hearing more about that in the future. I don't see any other questions, but we'll give it one more pause, 15 seconds or so, in case any other questions come through. And while we're waiting on that, Dr. Joseph, I don't know if you have any closing words for us before you sign off.
I don't. I hope that you all feel like you're ending your week having been filled with new ideas and inspiration and support of your peers and your broader health center community. And just please know that we're cheering you on and are really open and welcome and really want to hear your feedback about how we can be better partners to you.
Great. Thank you so much for being with us today. We appreciate you.
All right. Bye, all.
Bye. Tell Jim we said hi when you call him back.
Okay. We're calling back. Okay.
Okay, if Vita, if you will go ahead and launch our poll for this session so people can start completing that. I think we can go ahead and close the poll and move on to our last portion of the conference, which is our word presentations and raffles. First, I'm going to play one more sponsor video.
For over 80 years, we've been inspired to be part of a community that comes together. We roll up our sleeves to take care of each other. We do whatever it takes to make Arizona a healthier place. When Blue Cross Blue Shield of Arizona got the call from the state, we stepped up to help Arizona recover from the pandemic. Because even when things seem their darkest, we're coming together to bring in the light. We're now seeing so many Arizonans volunteering, working together, taking the extra step to care for one another during a real health crisis. Working so tirelessly to help Arizona recover. We're proud to be part of this effort because hope is here. And while we still have to proceed with safety, a new day is coming into view. And it's shining its light on our community working together to inspire a healthier Arizona. So each of us can return to what we love and do life. For over.
Right. Thank you to our last session sponsor of the conference, Health Choice Blue Cross Blue Shield of Arizona. Their contact information is on the screen. As I said earlier, we encourage you to reach out to our sponsors. All right, and now I'm delighted to introduce Lisa Nieri, our interim president and CEO.
Thank you, Danelle. I just want to make sure my audio is okay and video's not okay. Wonderful. So I doubt that Dr. Josephs is still on the line with us, but in case she is, and I want to say to the rest, to everybody else also, that a lot of her comments really resonated with me in particular, especially around just not more doors and more services, but really looking at how we provide services. And also the equity lens that is on everything that we do now. I think that that really embraces the heart of the health center program and the whole mission and brings it and really does that in a more modern way. So I'm excited for that and I'm really hopeful also. So thank you, Danelle. And yes, my name is Lisa Nieri and I'm really happy to be here representing the Alliance today. While I have this opportunity and audio and video, I really just want to say thank you, Danelle, for all of your work along with Vida to bring this annual meeting together. You make it look really easy, which only means that there's a tremendous amount of work behind the scenes. To our attendees, if I were in person, I would ask everyone in the audience to join me in appreciation of my colleagues, Danelle Peterson, our Director of Communications and Training, and Vida de Jesus Lopez, our Training and Marketing Coordinator, and of course, the many other Alliance staff members that volunteer to facilitate and organize and support all of these efforts. So thank you all very much, and thank you for the time to indulge me with that. So I just like to say that we are so very proud of our health centers and the work that you do every single day, but we are in awe of what you've managed to do in what is now more than a year of unprecedented challenges. You have not only risen to the occasion, but have surpassed expectations and found really creative ways to make sure that your patients and your communities continue to get the care they need in the way that they need to get it. You have been on the front lines of everything COVID related, and because of our mission and what we do best, you've been able to address issues of health equity and make sure that our most vulnerable patients and community members are not forgotten. So the staff at the Alliance are very proud to do the work that supports your mission. Okay, let's go forward and just recognize our awardees so far. A little bit of information. The Alliance members serve 1 in 10 Arizonans and 1 in 4 Medicaid patients. And that just would not be possible without healthcare heroes like our 2021 awardees. Although we've been featuring all of the awardees throughout the conference, we really want to take this one last opportunity to recognize those that have supported our health centers and the health center staff that have been recognized for their outstanding work. So I'm just going to go through a quick list. Our 2021 legislators of the year were Representative Joanne Osborne and Dr. Randall Fries. Thank you. Our 2021 Innovation Award went to Dr. Brianna Hiller, the Director of Dental Services at Chiricahua Community Health Centers. Our 2021 Preceptor of the Year was Dr. Matthew Birch, Director of Pharmacy at Sun Life Family Health Center. Our 2021 Invaluable Community Health Worker was Leslie Todd from North Country Healthcare. Our 2021 Invaluable Dental Assistant was Margaret Zamora from Valleywise Health. Our 2021 Invaluable Medical Assistant was Alejandra Rodriguez from Teros Health. Our 2021 Special Populations Award went to Julio Quesada from North Country Healthcare. And our 2021 Lifetime Achievement Award went to Travis Robinette, who you heard from earlier this morning, the CEO of Sun Life Family Health Center for more than 23 years of service to the health center program and his community. So thank you, Travis. You've been a mentor to many here in our membership and to us at the Alliance, so thank you. So congratulations one more time to all of the awardees. Before I pass things back over to Danelle to facilitate our raffles, I want to also express my gratitude to our sponsors. Our annual conference wouldn't be possible without our sponsors who've been here throughout the week to show their support of Arizona's health centers. Thank you to Arizona Complete Health for being our lead 2021 annual conference sponsor, along with our swag kit sponsor, Cintas, our lunch sponsor, CareQuest Institute for Oral Health, and our many session sponsors and award sponsors. I'm encouraging all of our attendees to visit the conference website to learn more about our sponsors and to reach out to them directly if you need additional information. When you registered, we asked you to identify some of the products and services